Alright, so my name's Christine, and this is my patient. I'm going to be doing the head to toe assessment on you today. So of course the first thing we did is we washed hands and I donned gloves. So now we're going to check the head. First we note the symmetry of the head, we note the symmetry of the eyebrows, the palpebral fissures, and the nasolabial fold. So everything looks symmetric. Then we palpate the scalp, so this is the glove we're for. So we're going to just check the scalp, just kind of light touch here. And the scalp is smooth. Do you have any pain anywhere?
Nope.
So there's no tenderness. Okay. Next thing we're going to do is we're going to check the temporal arteries. So I'm just going to, there we go, we have pulses here. And we have pulses here. So now we're going to check the temporal mandibular joint. So go ahead, open your mouth. Alright, so close mouth. Smooth movement. Do you have any pain?
Nope.
Okay, good. So now I'm going to check cranial nerve 5 and 7. So I'm going to ask you to clench your teeth really hard. Smile. Puff cheeks. Squeeze your eyes really hard. And wrinkle your forehead. Alright, there we go. So cranial nerve 5 and 7 are intact. Next thing we're going to do is we're going to check the eyes. So we're going to assess the extraocular muscles and the 6 fields of gaze. We're going to have the patient look at the tip of this here and then just follow, don't move your head, just follow with your eyes. So now we're checking cranial nerve 3. Now we're checking cranial nerve 3 and 6. This is 3 and 4. 3 and 4. 3 and 6. And 3. Alright, thank you very much. So all the cranial nerves are intact. Then we're going to check confrontation. So this checks like the peripheral vision. I'm going to go ahead and ask you to put one of these cards over one eye. And then I'll go ahead and put it over the same side. So I'm going to wiggle my fingers and you let me know when you see it. Alright, now we're going to check the other side. Wait. Okay, so good peripheral vision. Okay, so then I'm going to dim the lights, and I'm going to check for pupillary response. So just look straight ahead, and I'm going to put light in the patient's eyes. So we're checking for direct and consensual. So we're checking that this pupil, so they're both reactive, they're both brisk response, but when we shine a light in the left eye, for example, the left eye will respond and the right eye will respond. So it's direct, meaning the left eye responded, and consensual, meaning they both respond. So the patient has direct and consensual response. So next we're going to check the ears. So just from looking, they're equal in size and bilateral. Also large ears can be familial. So I'm going to check for any pain. Do you have any pain when I move? So move the pin and touch the tragus, no pain. Doesn't appear to be any swelling or redness in the ears. We can also check with a light. Actually, we'll do this one. Inside. So there's no discharge or swelling or bleeding or anything like that. Some earwax is normal. Okay, so now we're going to check. Do you have any pain when I palpate here? In the mastoid process? Okay, so no pain. So now we're going to check the nose. So just looking at it, it's symmetric in its midline and it's proportionate to the facial features. We can look inside, just make sure there's no swelling or anything like that. But we're also going to check for nasal patency. So I'm going to push down on one side. Go ahead and breathe in. Okay? Breathe in. Okay? Now check the other side. So both are patent. Next thing we're going to do is we're going to check the mouth. So just from looking at it, the lips are moist and free of lesions. Go ahead and open your mouth. So I can use a tongue depressor to look inside. So kind of like. good in there. Mucous membranes are pink and moist. You can close your mouth. The teeth are straight. So the teeth are straight, evenly spaced, or free of debris. And the gums, go ahead and open. The gums are pink and moist and stippled. And there's no bleeding or discoloration. Okay. So, when I checked the tongue, it was free of white patches or lesions. Go ahead and stick your tongue out. All right, and now push the tongue on each side. There we go. And so when I looked in there, the pharynx was also free of exudate or lesions. Go ahead and open your mouth. Say ah. So the uvula and the palate rise when he said ah. So we were checking cranial nerve 10 is intact. Next thing we're going to do is we're going to check the neck. So the thyroid is on either side of the trachea, so that's where you can find it. We're going to do the posterior approach to check the thyroid. So posterior approach is one hand on either side. Just place it on one side and then palpate. We can also do that by having the patient drink a little bit of water. So the thyroid rose when he swallowed. Now we're going to check the other side. Okay, also rose when he swallowed. Okay, so it was normal. They didn't feel any bumps or lesions. Was there any pain?
Nope.
So no pain. So now we're going to check the lymph nodes. So we're going to check first the pre-auricular lymph nodes, the post-auricular lymph nodes, the occipital lymph nodes, the submental lymph node, the submandibular lymph node, the tonsillar lymph node, the superficial cervical lymph node, the post-cervical lymph node, and the supraclavicular lymph node. So I didn't feel any of them. None of them were swollen, or did you have any pain over any of them? No tenderness anywhere. So all the lymph nodes are good. We're going to palpate the carotid arteries. So we have to do it one at a time, so we don't occlude them. And cut off blood flow to the brain. So there's a pulse there, and there's a pulse there. And then we can auscultate it. We have to auscultate it with the bell. So we're checking for bruise, and I didn't hear any bruise.